A silent threat, 8 signs that could indicate cancer. Do you ever feel unusually tired or drained? Get frequent infections? Have you experienced unexplained pain or discomfort? You may be wondering what's going on with your health. Sometimes vague changes turn out to be red flags, foreshadowing a bigger issue brewing under the surface. While most prove benign with simple fixes, others can reflect sneaky signs of emerging cancer. Catching cancer early dramatically boosts survival rates, thanks to expanded treatment options. By recognizing subtle symptoms sooner, we get checked out quickly when something feels off to thriving through the journey. Monitoring new or persisting abnormalities offers a starting point. Let's review potential indications of this stealthy disease to stay vigilant about our well-being. Here are 8 signs that could signify hidden cancer if they seem strange or stick around. Unexpected weight loss. One potential marker involves unintentional weight loss over time without actively dieting or ramping up exercise. Cancer disrupts metabolism and hormone balance, revving up the system into fat and muscle tissue breakdown. The tumors leak chemicals, triggering losses along with nausea and hampering intake. Gradual slimming despite the same or growing appetite deserves evaluation regarding its cause. It implies something internally acts to drop pounds silently. Blood work helps determine if an underlying medical issue exists, and further testing seeks hidden malignancy explanations when unclear, despite screenings. Track the unexplained shrinking weight closely. Skin changes. Ongoing skin changes, possibly signaling cancer, include new growths or moles plus alterations in existing spots or lesions. Dark pigments amplifying on the skin that spread asymmetrically or display irregular borders with variable colors, especially black, brown, and the angry, colors, erythema and reddening, deserve inspection. Red, scaly, patchy rashes lasting over a month could also indicate precancers like actinic keratosis from UV damage. Nagging itchiness, non-healing crusts, or wounds likewise warrant attention to rule out squamous cell risks. Notice thickened skin sections feeling hard and large colorless or pink shimmery patches on the torso indicating deeper issues. Skin frequently mirrors inner processes. Monitor oddities. Unusual bleeding. Recurrent nosebleeds. Heavy menstrual flow or bleeding between periods. Blood in urine and stool changes. Prolonged gum bleeding. Unexpected bleeding embarrasses and worries. But dismissing irregularly spotted blood without clarity around origin would cause the courts danger. Nosebleeds from outside injuries rarely persist unless an underlying disorder exists, like hypertension, vitamin deficiency, or clotting protein imbalance. But nasal passages and sinuses also provide ripe breeding grounds for preliminary cancers. Cervical, ovarian, and uterine cancers prompt uterine bleeding alterations like heavier, prolonged, or erratic menstruation. Stomach, intestinal, and bladder malignancies make blood appear in vomit, urine, or stool too. Oozing gums signaling gingivitis may evolve into mouth tumors if inflammatory imbalance goes overlooked despite tending teeth and flossing properly. Blood warrants investigation, not assumptions. Swelling and unexplained lumps. A novel lump on any body part that persists longer than a month with no shrinkage deserves medical scanning to determine its identity. Note enlargements near lymph drainage points like the neck, groin, and armpits must rule out immune-linked lymphoma risks. Growths inside the abdomen, pelvis, or breasts that are expanding, feeling hard, fixed, or painful need the exclusion of cancer's insidious spread. While most random bumps and swellings show harmless origins, neglecting those continuing unabated, or inflation in strategically vulnerable sites, leaves room for hazards going undetected until too advanced. Getting lump feedback offers peace of mind when simple explanations exist, or early catches, if not. Stay alert to local increases hiding silently. Chronic coughing or hoarse voice. Hacking coughs are familiar wintertime sounds, but less common when stepping into sunny seasons, without infectious instigators, like the cold, flu, or allergens. Gradual voice hoarseness also falls outside the norm without explainable laryngitis. Both may indicate lung tumors irritating pathways or early metastases tweaking nearby nerves. As malignancies advance, they meddle with breathing capacity through obstruction or fluid buildup. If drainage channels narrow from invasive compression or secretory disruption, congestion results. We clear it by coughing. So newfound frustrating coughs or vocal changes sticking around deserve the exclusion of an underlying trigger like cancer interfering surreptitiously. Don't ignore chronic respiratory red flags. Indigestion and bowel habit shifts. Stomach upset keeps antacid companies in business, but becomes concerning when unrelieved through usual tactics like food adjustments, OTC remedies, or prescription inhibitors. Intensifying heartburn, reflux, nausea, cramping, constipation, and diarrhea all indicate digestion is awry. Noticing pale or dark stools, blood specks, narrow shapes, or mucus signals abnormalities. The GI tract commonly falls prey to tumors disrupting organ function or narrowing tubes, essential for smooth flow. Ensuing inflammation alters acid production and gut mobility. Nutrient deprivation, weakened immunity, and strain on detox organs give cancers fuel to expand quietly at first. But eventually signs like capacity changes and bleeding prompt those vigilant to check in, based on irritating fluxes. Headaches and vision changes. Squinting, seeing spots or flashing lights, eye dryness or pain, plus distorted or double vision, seem like pesky eye issues. But if exams can't pinpoint a refractive error or ocular cause, don't dismiss them without considering a systemic spring like metastasized cancer, spreading to orbital regions. Similarly, raging migraines and headaches that worsen, despite the avoidance of food triggers or usual remedies warrant scrutiny. Head pain often channels inflammation elsewhere, including malignancies, oozing vessel-irritating substances, and early central nervous system infiltration. If you lack risk factors like family legacy but battle escalating headaches with aura or vision irregularities, request scans. Fatigue out of proportion. Exhaustion plagues the fast-paced, but merits concern if amplified beyond routine rhythms tied to busyness, then recovery. Review rest habits, ensuring enough sleep, nourishment, and support demands. But if crushing tiredness persists despite 7+ hours and lifestyle tweaks, blood work helps evaluate depletion, coupled with imaging to seek out explanations. Advanced cancers drain energy reserves by sapping building blocks through invasive appetite and rapid reproduction. Tumor bleeding also diminishes iron carrying oxygen efficiently to energize muscles and organs. Immune hyperactivity further taxes the system. Unyielding exhaustion disproportionate to output levels deserves exploration rather than willful ignorance. Measure baselines. If any abnormal or exaggerated shifts in your body stick around, or slowly crescendo in the background, bring them into the foreground. Cancer starts subtly before obvious declarations like pain or concrete diagnoses down the line. By tuning into the whispers early, we catch shouts happening before it's too late. Discuss vague questions with your doctor, asking about screening tests relevant to your age, exposures, and family tree. In many circumstances, symptoms show harmless causes, but peace of mind prevails when you can rule out the worst-case scenario. Listen deeply to the nuanced language of your wise body. Lean into its healing potential by caring for it proactively through smart lifestyle medicine choices and vigilant awareness practices. We've seen 8 signs that could indicate cancer. Here are 6 lifestyle factors promoting cancer prevention and fighting capacity if facing diagnoses. Regular cancer screening tests. Discuss guidelines for screenings aligned with your age, gender, health status, and genetic legacy with your doctor. Those with first-degree relatives battling cancer may start earlier than standard recommendations. Common tests span colonoscopies, FIT testing for blood and stool, Pap smears for cervical cancer, mammograms evaluating breast tissue, PSA markers tracking prostate cancer risk, chest X-rays searching for lung issues, and any scans relevant organs or problems run in your family. Set reminders to retest at established intervals, based on test outcomes and medical suggestions specific to your profile. This enables early detection and removal of precancerous growths before formations spread. Screening saves lives by leveraging the benefits of discovering cancer's stealthy stirrings when intervention improves outcomes before late-stage speed. Diet, anti-inflammatory and plant-based. Choosing diets incorporating copious vegetables, fruits, and unrefined whole grains reduces cancer risk by including compounds that block damage to DNA, suppress malignant transformation, slow replication rates, and cut off the proliferation sustenance cancer cells need. These phytonutrients protect entry points where cancers take hold if exposed to fewer growth accelerants. Reduce intake of processed and fried foods, alcohol, conventional meats, sugars, and refined carbs, which are shown to feed tumors. Anti-inflammatory eating controls underlying risk factors, fueling your best healing potential. Nutrition modifications make huge impacts based on the willingness to learn and lean into support resources, freely sharing knowledge. Supplements, targeted protection. Research-supported supplements add extra ammunition against cancer's cellular derangements, especially helpful during active treatments that throw normalcy temporarily out of balance or when boosting deficiency-prone nutrients like magnesium, zinc, and B vitamins taxed by the common toxicities of modern life, alongside genetic variations influencing individual biochemistry. For example, curcumin, vitamin D, probiotics, omega-3s, mistletoe extract, melatonin, green tea, mushroom extracts, modified citrus pectin, and bromelain enzymes help modulate aspects of immune function, cell signaling, programmed death circuits, and surrounding tissue environments to make them less hospitable to survival and spread. Always run additions by your doctors to ensure safety and efficacy. Targeted supplementation bids welcome the assistance nature already provides. We simply boost access through proper preparations based on history and holistic evaluations. Stress reduction through spiritual mental practices. Cancer journeys depend as much on nourishing spirit's insanity throughout its chaos and questioning, as on surgical and pharmacological interventions navigating disease-ravaged organs and body sites. Maintaining mental health and immune resilience through meditation, counseling, support groups, and self-care activities proves paramount. Spiritual connections combat isolation and enlarge perspective. Creative outlets release frustrations, productively channeling emotional debris into inspiration. Inner stability strengthens the outer capacity to weather storms. By proactively preparing through these outlets before day-to-day functioning requires it, we build the equivalent of emergency savings accounts, enabling access to supportive resources later, when inevitably needed. Even simple acts of slowing down, being present with gentle breathing, enjoying beauty, and laughing, often subtly bolster reserves, protecting priorities and well-being. Stress damages DNA as much as any toxin, increasing cancer opportunities literally at cellular junctions. Sweat out tensions with movement, hug loved ones, and sustain faith through uncertainty. Your essence always remains whole. Reduce toxin exposures and habits. Minimize environmental exposures shown to trigger cancer development as reasonably as possible, especially potent hormonal disruptors, heavy metals, pollution, radiation sources, and chemicals demonstrating genotoxicity. Eliminate habits that strain the body, like smoking, synthetic hormone replacement therapies without clinical necessity, or excessive drinking shown to impair immunity and methylation capacity needed to reduce mutation risks. Carefully vet the necessity when risks emerge regarding the spectrum of screening tests, certain medications, and standard procedures imparting cumulative radiation. Some prove life-saving despite the downsides, while others invite unnecessary insults through close-minded adherence to generalized rather than personalized recommendations. Stay aware of continuing research shaping evolving best practices. Embrace bouts of fasting. Beyond lean eating and caloric moderation, consider embracing intermittent fasting windows spanning 12 to 16 hours without sustenance on a regular basis as supported. Limiting intake to 30+ hours weekly enforces metabolic recycling processes where the body cleans house and removes cellular debris. This facilitates apoptosis, where dysfunctional precancerous cells self-destruct on programmed pathways. Fasting gives digestion a break while biomechanics support self-regulated cell death reboots. This biologically natural reset switch likely encouraged spontaneous remissions, before modernity provided constant food access, thwarting innate benefits embedded in evolutionary processes. Our body knows how to heal when supported properly. Cooperate with its wisdom as much as possible. Conclusion: prevention is the best medicine to reduce risk proactively through screening, diet, stress management, toxin reduction, and metabolic regulation techniques like intermittent fasting. If facing cancer already, tailored lifestyle adjustment in these realms helps support foundations combating instability while empowering patient quality of life alongside frontline medical treatments. Small consistent shifts nurture transformation in trustworthy time. Health happens gradually, then suddenly in the accumulation of tiny actions through unrelenting commitment to self-care. We all walk together. Stay persistent in realistic hope, unconditional self-worthiness, and caring community. If you enjoyed this video, don't forget to like, subscribe, and leave a comment below. Together, we are winning health.